The fluorescent lights hummed at 3 in the morning, that particular frequency only audible in the dead hours when the hospital breathed like a sleeping animal. Ashley Cooper pushed through the employee entrance at Seattle General in Colorado Springs, her scrubs still damp from the rain outside, the November cold clinging to her shoulders. Nobody looked up. That was the point. She moved through the corridor with the kind of invisible efficiency that came from years of practice, not hurrying, not lingering, occupying space the way ghosts occupied rooms. The antiseptic smell burned her nostrils, sharp and chemical, mixing with something underneath it that smelled like old coffee and human exhaustion. Her left leg ached with a dull throb that had nothing to do with the weather. The limp was slight, barely perceptible unless you were looking for it. Most people weren't. The break room sat at the far end of the unit, its door propped open with a wedge. Inside, 3 nurses sat hunched over smartphones and a mug of coffee that looked like it had been reheated 6 times. Ashley pulled her locker open, number 247, bottom row, and began hanging her coat. The fabric crackled slightly as she moved. Her hands, she noticed, had started trembling again at the edges. She pressed them flat against the cool metal of the locker until the shaking stopped. There. Folded into a perfect triangle. The flag. It sat on the shelf above her spare stethoscope, tucked behind a textbook she'd never opened and a half-empty bottle of ibuprofen. The fabric was military blue with gold threading, and it carried the weight of something that weighed almost nothing. Ashley's fingers traced the triangle's sharp edges, following the crease that had been folded 847 times since she'd placed it there, give or take. The flag from Sergeant Maria Ruiz's dress blues. The one from the ceremony nobody attended because the ceremony had to stay classified. The one from Bagram, 2021. The one from the operation that had legally erased Captain Ashley Cooper from every database in the Pentagon. Behind her, the 3 nurses stood up almost in unison. The scrape of chairs on tile sounded like applause nobody wanted to give. By the time Ashley turned around, they were already moving through the door, carrying their phones and their half-finished coffee. One of them, Rachel, maybe, or Rebecca, glanced back with an expression that was supposed to look neutral. It looked like pity instead. Ashley didn't react. The mask stayed in place, smooth as surgical tape. "Morning," she said quietly to their departing backs. Nobody answered. The graveyard shift at Seattle General ran like a skeleton crew operating a body that couldn't quite stay awake. 2 surgeons upstairs. 1 cardiologist on call. For nurses for the 8 ICU beds, which meant each nurse was stretched thin enough to see through. Ashley had learned to move through that thinness without leaving ripples. Check vitals at 0320. Chart at 0335. Walk the perimeter. Exist without asking anyone to acknowledge the existence. ICU bed 7 sat at the far end of the unit, curtained off on 3 sides, open to the hallway on the 4th. The monitors above it beeped with the kind of steady rhythm that meant the patient wasn't dying today, which was the best thing you could say about most mornings at 3 o'clock. The ventilator hissed its mechanical breath, in, hold, release, repeat, and the fustand stood like a metal sentinel with 3 separate lines running clear fluid into the arm of a Marine who looked too young to be in a hospital bed. Corporal Devon Hayes had the kind of face that belonged to recruitment posters, sharp jaw, steady eyes, the confident bearing of someone who'd been taught to think of himself as invincible. His left arm lay outside the sheets, and on the forearm, in letters that stood out dark against skin still tan from a deployment that had ended for months ago, was a tattoo, A. Cooper. Ashley had seen that tattoo before. She'd just never seen it on a living man's arm. The morphine drip kept his pupils dilated, kept his expression somewhere between dreaming and awake. She'd been his captain for 847 days across 2 tours. She'd carried him through Taliban fire while his blood soaked through her field jacket. She'd held pressure on a shrapnel wound that should have been fatal while helicopters thumped overhead like gods deciding who lived and who didn't. She'd whispered his name in the dark, "Stay with me, Hayes, stay with me," while her hands did things that hadn't been in any army manual she'd ever read. Now she was checking his vitals, and he was staring through her like she was furniture. "Hayes," she said softly, checking the dressing on his left side where the surgery had left a scar that would probably last longer than the memory of what had caused it. "Can you hear me?" His eyes tracked toward her voice, but there was nothing behind the movement. Just reflex. Just drugs and sleep deprivation and a brain that had learned to survive by not asking questions about faces it no longer recognized. She supposed that was fair. 3 years. A different uniform. Hair long enough to tie back. Hands that weren't covered in dust and dried blood. She wasn't the same person he'd known. Maybe that made them even. "Oxygen sat looks good," she said, speaking the words to his chart rather than to him, keeping her voice level and professional, the way a nurse should sound when she was checking on a patient with no history to her, no weight beneath her, no significance except as vital signs on a screen. "We'll keep monitoring the surgical site. Dressing's clean. No sign of infection." She adjusted the four-drip, fluids running at 125 milliliters per hour, clear as water, and made a note in his digital chart. The screen glowed blue in her face. Behind her, she could hear the faint sound of rubber-soled shoes on linoleum, the distant beep of another monitor down the hall, the hum of the building's circulation system pushing warm air through vents that had never quite learned how to be quiet. "You're doing good," she whispered to him, "the kind of thing you say to unconscious patients and fading soldiers, things nobody else gets to hear. Real good." His eyes rolled slightly back toward the ceiling. His tattoo caught the light. That wasn't the worst part. The worst part happened at 0347, when Dr. Marcus Pierce walked through the ICU doors with a cup of coffee that steamed in the cold hallway air. He was a man built the way confidence is built, broad shoulders, expensive watch that caught the fluorescent lights, the kind of presence that made other people move out of his way without being asked. He'd been chief of ER for 7 years, which was 6 years and 11 months longer than he'd been competent at it. Most days he ran the unit like he was conducting an orchestra of people he'd already decided would fail him. Most days, he was right. Pierce stopped at the nurse's station and looked at the monitors, his jaw working like he was chewing on something bitter that wouldn't dissolve. His eyes moved across the screen showing Hayes's vitals, heart rate 62, blood pressure 118/74, O2 sat 98% on minimal support, and then they moved across the unit to where Ashley stood, still checking the foresight on Hayes's arm with the kind of focused attention that meant she wasn't paying attention to being watched. His stare felt like weight pressing down from above. Like the moment before a helicopter blade starts spinning and the rotor wash becomes strong enough to knock you sideways. Ashley didn't look up. The rule was simple: don't acknowledge the weight. Don't flinch. Don't let him see the calibration of her hands as she confirmed the catheter placement with the precision of someone who'd started more difficult falls in worse conditions than a hospital bed. Don't let him see the way her eyes tracked Hayes's vitals with the instinctive assessment of someone trained to know whether a patient had 6 hours or 6 minutes. Most of all, don't let him see that she knew he was watching. She finished the forecheck, documented it in the chart with the kind of meticulous care that would make any nurse look competent, and moved to the next monitor. Her movements were economical, practiced, efficient, the kind of invisible competence that only looked normal until you realized how hard it was to move that precisely under fluorescent lights while someone was studying you like you were a mistake waiting to happen. Pierce's fingers tightened around his coffee cup. She heard the sound of it, the subtle shift of material against ceramic, the sharp intake of breath that meant something in him had just decided something about her. That was the moment the real trouble started. That was the moment he began planning how he would prove that Captain Ashley Cooper, if that was even her real name, if that rank even meant anything, if she had actually earned any of the quiet competence she moved through the world with, didn't belong at Seattle General. He didn't know her name, not really. He didn't know the weight of the flag in her locker or the reason her left leg ached on rainy mornings or the specific calibration of her hands, which had been trained by people the Pentagon preferred to forget. He saw a nurse with a level 2 credential performing at a level 5, and that was enough to make him angry. He didn't know he was standing next to a legend. He didn't know he was building a case against someone who'd spent 847 days learning to survive the unsurvivable. But that was about to change. The rain that had soaked Ashley's scrubs on arrival continued to fall outside the ICU windows, hard and relentless, a percussion line beneath the steady hiss of medical machines. By the time her shift ended at 0700, it had washed the parking lot clean and left everything shining like a weapon. The morning rounds began at 0730, when Dr. Pierce arrived at Seattle General like a man carrying a personal vendetta in his white coat. Ashley was already in Corporal Hayes' room, checking the cardiac monitor leads, her fingers moving with the kind of precision that came from muscle memory and 18 years of knowing exactly what a failing heart looked like on a screen. The 4-bag hung above his bed in perfect vertical alignment. His oxygen saturation read 96%. Everything was exactly as it should be. Dr. Pierce entered with Hayes' parents trailing behind him, Mr. and Mrs. Hayes, both wearing the particular exhaustion of people who had spent 3 days watching their son's chest rise and fall with mechanical assistance. Dr. Pierce's voice carried the honey-smooth tone of a man about to perform surgery without anesthesia. "Nurse Cooper, perhaps you could explain to Mr. and Mrs. Hayes why you performed an unauthorized central line placement yesterday." Ashley's hand stilled on the monitor. She did not turn. She let the question hang in the recycled air of the ICU for exactly 2 seconds before responding. "I followed the attending's verbal order during the code, Doctor." "Did you?" Pierce moved closer, his posture suggesting he was genuinely puzzled rather than accusatory, a technique far more devastating than anger. "Because I have no record of that order." "Tell me, where exactly did you receive your advanced cardiac life support certification?" "Because it's not in your file." Hayes' mother inhaled sharply. Her hand found her husband's arm. Ashley's jaw clenched. Once. Imperceptibly. The kind of clench that would take a trauma surgeon to notice, the kind of reaction a woman learns in rooms where showing pain meant showing weakness, and showing weakness meant not coming home. Seattle Community College, 2022, Dr. "Interesting." Pierce tilted his head, a gesture that suggested fascination rather than doubt. "They have no record of you in that program." "That's peculiar, isn't it? A facility has records. Records are permanent. Records are how we know people are who they claim to be." Her hands remained perfectly steady on the medication cart. Steady as a surgical laser. Steady as a sniper holding position for 8 hours in a hide overlooking a valley in Helmand Province. Her voice, when it came, was flat as Kansas prairie. "Understood, Doctor." She returned to her charting as though he had merely commented on the weather. As though he had not just planted doubt in the minds of 2 parents whose son was currently tethered to machines keeping him breathing. As though the implication, that she was dangerous, that she was fraudulent, that her hands had no business touching their child, had not landed like shrapnel. Pierce lingered for another beat, watching her work, clearly frustrated by the absence of a reaction. When she did not look up, did not defend herself, did not tremble or explain, he turned back to the Hayes family with an expression of concerned competence. "I'm ordering additional monitoring protocols. Nurse Cooper is still in her training phase here at Seattle General, and we want to ensure all procedures are documented and approved before they occur again." Mrs. Hayes nodded, her trust now fractured in ways that would take weeks to repair. By 1200, the rumor had spread through the hospital like infection through a wound. Dr. Pierce had spent the morning making calls. First to Dr. Sarah Chen, his former mentor at Colorado Springs Community College, who confirmed in clinical tones that she had no record of an Ashley Cooper completing the nursing program in 2022. Then to the hospital board's credentialing committee, where he mentioned, offhandedly, as though troubled by a small administrative concern, that one of their nurses might have falsified her educational documentation. Then to 3 other physicians who owed him favors, each receiving a text message, "Watch for unprofessional procedures from Cooper in ICU. Patient safety concern." The break room at 12:45 was where Ashley learned how effective social sabotage could be. She entered to grab a sandwich she had packed the night before, her movements quiet as always. Nurse Jameson was pouring coffee from the thermal pot. When Jameson saw Ashley in the doorway, her hand stilled. She set down the pot. She picked up her mug, full, and left the room without pouring it. 3 seconds later, Nurse Patel gathered her phone and her banana and followed. Then the rest, Chen from pediatrics, Morrison from the surgical floor, two nurses Ashley had never directly spoken to but who worked within visual range of the ICU. The room emptied like a tide going out, leaving Ashley standing alone with her sandwich and the fluorescent hum of the overhead lights, a sound like electricity slowly cooking the atmosphere. She sat at the table. She opened her lunch container. She ate methodically, each bite timed and controlled, while her knuckles whitened slightly around her water bottle. Not from fear. From the specific kind of restraint that comes from knowing you could break that bottle with one hand and that breaking it would prove every accusation. The trembling, if it came, was not fear. It was restraint. At 13:30, Dr. Pierce posted the formal reprimand on the unit board outside the ICU doors. The paper was white and official and laminated in plastic that would preserve it for weeks. Nurse A. Cooper, written warning for an authorized advanced procedures, performance improvement plan initiated. 12 staff members read it over the course of the next hour. Hayes's father read it while visiting his son at 14:45, and the way his expression shifted, from confusion to concern to something resembling doubt, told Ashley everything she needed to know about the velocity of doubt once released into a closed system. At 1500, Dr. Pierce called her over to the nurses' station in front of her other staff members and a family member waiting to see a post-op patient. "Cooper, you're a danger to patients. I'm watching every chart you touch." She met his eyes. Not with anger. Not with defense. With the kind of flat, unreadable composure that made powerful men deeply uncomfortable. "Yes, doctor." Her voice was constructed from steel and silence. He leaned closer, his tone dropping to something almost intimate, almost conspiratorial. "You're a fraud, and I'm going to prove it." Ashley held his gaze for exactly one more second. Then she turned and walked back to Hayes's bedside, where the young Marine lay watching her with eyes the color of autumn water, the eyes of a stranger. She had carried him through fire. His blood had soaked into her combat uniform at the Bagram Phi base perimeter when an IED shredded his squad's convoy. She had performed a field thoracotomy with a blade meant for utility purposes while rounds snapped overhead like angry wasps, her hands working through muscle memory and adrenaline while he bled out beneath her palms. She had brought him home. His forearm bore her name tattooed in military Gothic, the letters permanent and black. And he did not know her. The morphine drip kept him floating in a space between consciousness and mercy. She adjusted his for flow with the kind of precision that was born from muscle memory, from 3 tours where failure meant flag-draped coffins. But that wasn't the worst part. The worst part was that Dr. Pierce was right, not about the fraud, but about the danger. Because when Hayes coded, when his heart stopped, Ashley's hands would remember things his mind had mercifully forgotten. They would remember protocols that existed nowhere in any official documentation. They would remember how to save him using methods that belonged to war, not to hospitals. And then everything would change. Hour 36 found Hayes drifting in that space between morphine and fever dreams, his body beginning to betray him in ways nobody had anticipated. His oxygen saturation had slipped from a comfortable 95 to 88 over the course of the morning, a slow and steady descent that nobody seemed to notice except Ashley. She watched the monitor numbers fall like a countdown, 92, 89, 87, each point a small warning that the residents and interns walking past his bed seemed content to ignore. His respiratory rate had climbed to 28 breaths per minute, his chest heaving with the effort of pulling oxygen through lungs that were beginning to fill with something other than air. She had seen this pattern before. In Bagram, it meant minutes, not hours. Dr. Pierce stood at the nurses' station 3 beds away, close enough to watch but far enough to maintain plausible deniability. He had been positioned there all morning, his eyes tracking every time Ashley approached Hayes's room. She could feel the weight of his attention like pressure against her chest, the way a wolf senses the presence of a hunter. He was waiting for something, and she understood with a precision born from 18 years of reading hostile environments that he was waiting for Hayes to crash. When it happened, and they both knew it would, he would be ready to ensure that Ashley Cooper's hand stayed nowhere near the bedside. At 11:42, Hayes's monitor erupted into chaos. Not the organized chaos of a patient drifting towards sleep, but the violent arrhythmia of a massive pulmonary embolism, blood clots spinning through his lungs like shrapnel through soft tissue. His body convulsed. His monitor screamed. Code blue. The crash cart rattled out from the resuscitation bay with the sound of a weapons cache being breached, and bodies moved in the choreography of emergency medicine, resident running, nurse grabbing the defibrillator pads, another nurse pushing epinephrine into his full line. The fluorescent light seemed to pulse with the room's sudden violence. Dr. Pierce was there in 3 seconds, moving with the speed of a man who had been expecting this exact moment. "I've got him," he announced, his voice cutting through the room like a scalpel. His hands moved to Hayes's chest, positioning himself for compressions. He was competent. That was the worst part. He had trained people in this room. He understood cardiac mechanics the way most people understood breathing. But he was also there for a reason beyond medicine, and Ashley recognized it in the angle of his body, the way he positioned himself between the bedside and the door. 36, 37, 38, Dr. Pierce counted, his compressions landing with practiced precision. The resident stood frozen for a moment, then grabbed the defibrillator pads. Ashley moved forward from the corner where she had been charting, muscle memory recognizing that Hayes needed intervention that compressions alone could not provide. His jugular veins were distending like ropes beneath his skin, the telltale sign of pressure building inside his chest cavity. Tension pneumothorax. The air being trapped in his pleural space was collapsing his lung, compressing his heart, suffocating him from the inside out. She was 3 steps from the bedside when Dr. Pierce's voice stopped her like a physical barrier. "You've done enough, Cooper. Step back." He said it without even looking at her, his hands never pausing on Hayes's sternum, and the words carried the weight of 18 months of accumulated sabotage. The room seemed to hold its breath. The other nurses knew what had happened in the past weeks. They knew the rumors. They had read the written warning posted on the unit board. Several of them looked away. Nobody contradicted him. "Second intercostal space, midclavicular line," Ashley said, her voice steady as a surgical laser. "He needs immediate needle decompression, doctor. The air pressure is collapsing his lung." She was not asking. She was not requesting. She was reporting clinical fact to a physician who was too focused on his own authority to hear it. Dr. Pierce's hands paused for exactly 1 beat. His eyes flicked toward her with something that looked like satisfaction. "I don't take orders from nurses with questionable credentials." "Continue compressions," he said to the resident, who immediately stepped into position and began the rhythmic pushing that kept Hayes's heart pumping but did nothing for the pressure that was suffocating him from within. The monitor showed Hayes's heart rate dropping. 120. 95. 82. Each number was a step closer to irreversibility, each beat a heartbeat that should not have been beating at all. The oxygen saturation continued its descent, 79, 76. Hayes's pupils were dilating. The window was closing. In 45 more seconds, it would close completely, and no amount of medical intervention would bring him back. Ashley had seen that window close before. She had held Marines as it closed. She had carried 3 wounded through Taliban fire because she refused to let that window close on her watch. She made her choice. She moved not toward the bedside but toward the crash cart, reaching with fingers that had practiced this motion across 3 deployments and countless field surgeries. The 14-gauge needle felt familiar in her palm, the kind of familiar that lived in the bone and muscle rather than in the conscious mind. She had used this exact instrument in a tent hospital in Sanjan Valley with nothing but morphine and adrenaline and the knowledge that the alternative was losing another team member. Dr. Pierce saw the movement, saw the needle, and his mouth opened to object, but Ashley was already past him, her body moving through space with the terrifying fluid precision of someone who had nothing left to lose. The second intercostal space. Midclavicular line. Her hands found the anatomical landmarks with hands that belonged to war, not to hospitals. She felt the ribs beneath her fingers, counted them with a tactile precision that bypassed conscious thought, and drove the needle through skin and muscle and into the pleural cavity where the pressure had been building, suffocating Hayes from the inside. The rush of air was audible in the sudden quiet of the room, a hiss like a tire releasing pressure, like the sound of life reasserting itself over the machinery of death. Air. Not blood. Just air, escaping, releasing the pressure that had been collapsing his lung. Hayes gasped. His back arched. His monitor showed the electrical chaos of a heart that was suddenly receiving oxygen again, reorienting itself, finding rhythm. 85 beats per minute. 90. 102. Normal sinus rhythm. His chest rose and fell in the synchronized breathing of a man whose lungs were no longer drowning. Ashley collapsed to her knees beside the bed, and for the first time in 18 months, her hands began to tremble. Not from fear. Not from uncertainty. The trembling was restraint, the involuntary shaking of someone whose body was releasing months of pressure all at once, whose muscles were finally allowing themselves to feel what they had been trained to ignore. She stared at her hands as though they belonged to a stranger, hands that had just performed an emergency procedure outside the chain of command, outside protocol, outside the boundaries that Dr. Pierce had spent months attempting to enforce. The room was so quiet you could hear the rain beginning against the windows outside, a sudden downpour that seemed to fall from nowhere, and in that silence Dr. Pierce's face underwent a transformation. The satisfaction drained from it, replaced by something that looked like rage and something else that looked like fear. He pulled out his phone with movements that were sharp and precise, his fingers moving across the screen with the urgency of a man who understood exactly what had just happened. "Get me the chief of surgery," he said into the phone. His voice was steady, but his eyes were fixed on Ashley, and they held the expression of a man who had just been cornered. "And hospital security. Now." Hayes's monitor continued its steady rhythm. His oxygen saturation climbed back toward normal, 89, 91, 94. His body was stabilizing. The color was returning to his lips. But Ashley was already understanding what she had just done, what she had just revealed about herself, with hands that belonged to a classified operation in Bagram, with knowledge that no floor nurse should possess, with a kind of instinctive precision that came only from years of trauma medicine in field conditions. Hour 42. The hospital fluorescent lights cast that particular shade of institutional white that makes everything look slightly dead. Dr. Marcus Pierce sat in his office on the second floor, the Venetian blind slicing the afternoon light into prison bars across his desk, and he began making phone calls with the precision of someone who had spent 15 years accumulating favors like ammunition. His first call was to board member Thompson at 1437. Thompson owed him. 3 years ago, Pierce had covered for Thompson's son, some narcotic discrepancy during a surgical rotation that could have ended a career before it started. The conversation lasted 90 seconds. "Thompson. It's Pierce. I need the nursing credential verification accelerated. There's a floor nurse who shouldn't be here." "Yes. Today if possible." "No, I'll handle the documentation. You'll see it by end of shift." He hung up before Thompson could ask questions. Favors worked best when they didn't require explanation. The second call went to Seattle Community College's Dean of Nursing at 1451. This one required more finesse. Pierce had taught there as an adjunct for 6 years before moving full-time to Seattle General. He knew the dean. More importantly, the dean knew what Pierce's recommendation had done for the program's credibility. Dean Harrison. Dr. Pierce from Seattle General. "I'm calling about Ashley Cooper. Graduated 2019 from your program? I need to verify the authenticity of her credentials." "Yes, immediately. I have concerns about fraudulent documentation in my department. RN license for 472189. No, I can't wait for standard channels. This is a patient safety issue." The dean agreed to a priority audit before Pierce even finished the sentence. The hiss of institutional machinery responding to institutional pressure. That was the thing about networks. Once you activated them, they moved like clockwork. By 1503, Pierce had placed a call to the State Nursing Board's investigative division. He didn't know the investigator personally, but he knew how to sound like someone who mattered. He cited credential verification concerns, mentioned a specific chart, Hayes's post-operative documentation from the night before, and used words like unauthorized advanced procedures and scope creep and patient safety at risk. The investigator agreed to send someone to Seattle General by 5 p.m. to begin chart review. Pierce sat back in his chair, which squeaked like small animal bones, and allowed himself a moment of satisfaction. He had just activated 3 separate institutional powers simultaneously. Ashley Cooper didn't stand a chance against this kind of coordinated pressure. She was a floor nurse. He was a doctor. He was connected. And connections were currency in healthcare. What he didn't know was that he had also just initiated the exact sequence of events that would destroy his career. At 15:44, as Pierce was reviewing the formal documentation he would use to justify Ashley's termination, security received a call from the ER charge nurse. Dr. Pierce wanted Ashley Cooper's badge deactivated. Immediately. The charge nurse, Maria, had been at Seattle General for 19 years. She had watched Ashley work for 7 months without incident. She had seen Ashley save lives with competence that came from somewhere deeper than textbooks. But she also knew that going against Dr. Pierce in front of hospital administration was career-limiting. She made the call. By 1612, Ashley Cooper's access badge had been electronically deactivated. The system would no longer recognize it. If she tried to badge into a secured area, alarms would sound. She found out when she tried to enter the medication storage room during her 1630 rounds. The electronic lock made a cold clicking sound, the sound of rejection, and remained sealed. The screen above it blinked red, access denied. Ashley stared at the screen for exactly 2 seconds. Her jaw tightened. Not a tremor, not a flinch, not even a visible reaction, just a microscopic tensing of the muscles along her mandible. She turned and walked to the charge nurse station where Maria stood with her arms crossed, her face a careful arrangement of neutral professionalism. "My badge is deactivated," Ashley said. "Not a question." Dr. Pierce's orders. "About 15 minutes ago." "I'm sorry, Ashley." It's fine." It wasn't fine. They both knew it wasn't fine. But Ashley had spent 23 years in situations where saying the wrong thing got people killed. She had learned that survival sometimes looked like compliance. She nodded once and walked toward the ER office where Dr. Pierce had requested her presence. The office door was closed. Through the frosted glass, she could see 2 figures. Pierce and someone else in a dark suit. An investigator. Of course. She knocked. "Come in," Pierce said, his voice carrying the particular satisfaction of someone winning. The next 3 minutes happened in the kind of slow-motion clarity that combat training produces. Pierce sat behind his desk. The investigator, a woman named Kessler with sharp eyes and a state nursing board badge on a lanyard, stood to the right. On Pierce's desk lay a stack of photocopied charts. Ashley's charts. 43 separate patient records from the past 6 months, organized chronologically. "These are your documentation entries," Pierce said, not looking at her. He was reading from a prepared statement. "Ms. Cooper, you are hereby suspended pending investigation into credential fraud and unauthorized advanced medical procedures. Your nursing license is under formal review by the State Board. You are to surrender your hospital identification immediately, and security will escort you from the building." Ashley felt nothing. That was the gift of combat training. Your nervous system learned to compartmentalize. Fear was information. Pain was data. Humiliation was just another kind of pressure, and pressure meant you were still alive. She pulled her hospital badge from her pocket and placed it on the desk. "I understand," she said. That was all. Not a defense, not an explanation, not even a question about the investigation. Just compliance. It was the same tone she had used when giving orders to Marines under fire. The same tone that made people follow her into impossible situations. Kessler from the State Board looked slightly uncomfortable. She had been expecting denial, anger, some kind of emotional response. She had not been expecting a floor nurse to simply accept her own professional destruction with the composure of someone receiving a weather report. Pierce stood. "Security is waiting at the ER entrance. You'll proceed directly there." Do not return to the unit, do not collect personal items, do not speak to staff. Ashley turned and walked out without another word. The walk from Pierce's office to the ER entrance took 93 seconds. During those 93 seconds, Ashley passed for nurses she had worked with for 7 months. 2 of them looked away. 1 pretended to be absorbed in a computer screen. 1, Jenny, who Ashley had trained on proper for insertion technique, briefly met her eyes with something that might have been sympathy, then quickly looked down. That was the professional code. Don't challenge authority. Don't rock the boat. Survive. Security escorted her through the ER entrance at 17:08. 2 officers, professional, not unkind, their hands resting on equipment belts. From the second-floor window above the entrance, Dr. Pierce watched with his arms crossed. He could see Ashley moving toward her car with the security officers flanking her like she was a criminal. He could see the afternoon light catching the edge of her hospital badge, still in his hand, already deleted from the system. He had won. He had used his network, his connections, his institutional power, and he had eliminated a problem. This was what strength looked like. What he didn't know was that strength was about to walk into his hospital wearing a uniform that hadn't existed for 3 years. Ashley's car was a 2008 Honda Civic with 147,000 miles on the odometer and a dent in the driver's side door from a parking lot in Kandahar that she had never bothered to explain. She sat in the driver's seat with both hands on the steering wheel and did not start the engine. The flag was in her gear bag under the seat, the one from her locker that she had kept for 8 years. The folded flag from Sergeant Maria Ruiz, who had died in Ashley's arms on a stretcher 3 kilometers outside the wire in Bagram, who had pressed a folded American flag into Ashley's hands in her final minutes and whispered, "Take it home. Someone has to." Ashley reached under the seat and pulled out the gear bag. She unzipped it. The flag was inside a clear plastic case, preserved the way military families preserve things they can't talk about. 8.5 by 5.5 inches of fabric containing 8 years of silence. She held it without opening the plastic. The weight was nothing. A few grams of synthetic material. But it pressed against her palms with the force of 3 dead Marines and a classified operation and a career that had never officially existed. The drive home took 17 minutes. Ashley did not turn on the radio. She did not call anyone. She did not cry. Crying required a kind of vulnerability that came only when you stopped moving, and she was not ready to stop moving. She was ready when she walked through her kitchen door at 18:48. When she sat at the kitchen table with the flag still in its plastic case in front of her. When the silence of her house, the house where she had tried to build a normal life for her 14-year-old son in a city where no one knew what she was, finally became unbearable. The first tear came at 18:52. Then another. Then a kind of silent collapse that came with the realization that Captain Ashley Cooper, who had led Marines under fire, who had performed field surgery with a combat knife, who had never asked for rescue and never expected mercy, had just been erased from a hospital because she was competent at something no civilian nurse should be competent at doing. 2 hours of silence. 2 hours of tears that came slowly, without sound, the way water seeps through cracks in concrete. The flag on the table. The kitchen light casting shadows that made the kitchen look underwater. Marcus found her at 19:06 when he came home from school. He was 14 years old with his mother's dark eyes and his father's high cheekbones and a backpack full of algebra homework he would never complete because in the next moment, everything in his world would reorganize itself around something he had been told never to touch. Mom. His voice was careful. He could read her the way soldiers learn to read terrain. Why are you home early? Mom, what happened? Ashley could not answer. The truth was locked behind protocols that had been written in classified briefing rooms and signed by people whose names she had never known. The truth was that she had been erased, and erasing worked only if you stayed erased. She shook her head. She could not speak. Marcus dropped his backpack on the kitchen counter and saw the cut hospital badge on the table. He saw the flag in its plastic case. He saw his mother, who never cried, who moved through life like someone made of steel and silence, breaking apart at a kitchen table on a Tuesday afternoon. He was 14 years old, and he understood instantly that something was ending. "Mom," he said quietly. "What happened to your job?" She still could not answer. He stood there for maybe 30 seconds, watching her. Then he turned and walked toward her bedroom. She heard him open the bedroom closet. She heard him move the winter clothes on the upper shelf, the ones he had been told never to disturb. She heard him pull down the metal box that weighed everything and nothing. The box that contained the decorations. The medals. The shadow box that had been wrapped and hidden and preserved for this exact moment that she had never wanted to come. The viral video hit 4.7 million views by Tuesday morning. Dr. Pierce's face frozen in that single frame, jaw clenched, eyes narrowed, voice cutting through the silence of the board meeting like a blade. "Medals can be purchased online, Mrs. Hayes." Behind him, a Marine colonel in dress blues, salute held at perfect attention. The internet didn't need context. The image said everything. By Wednesday, hashtags were trending. #Reaper6. #Pierce abused. #Hero nurse. The Colorado Springs Gazette ran the story with Ashley's official military photo, captain insignia visible, Bronze Star citation quoted in full, the kind of recognition that doesn't come from anywhere except the Pentagon itself. Dr. Pierce didn't check social media. He didn't need to. His phone was already ringing. The chief of surgery called first. Formal. Clinical. "Dr. Pierce, I need you to come to my office. Bring representation if you'd like." The word sounded like a death knell delivered by someone who'd already attended the funeral. He took the stairs instead of the elevator, hand steady, breathing controlled, trying to convince himself this was containable. It wasn't. The chief's office smelled like coffee gone cold and air conditioning set too high. On the desks at the printed email, forwarded from Boston, from Dr. Sarah Chen, the woman who'd mentored him through his residency, who'd written his fellowship recommendation, who'd shaped his entire surgical philosophy. "I taught you medicine, Stephen," her words read, each sentence striking like a hammer blow. "I did not teach you cruelty. I cannot defend this. I will not defend you." The chief slid the letter across the mahogany surface. The State Medical Board received this simultaneously with copies to our institutional review. "They're opening a formal investigation into whether you knowingly delayed emergency treatment to a trauma patient. We're suspending your privileges pending their findings." The words floated past him like a dream someone else was having. Suspended. Investigation. Delayed emergency treatment. The door behind him opened. Security. 2 uniforms, faces professionally blank. "Your office is being sealed," the chief said quietly. "You can take personal items. Nothing related to patient care. We'll need your badge and your access codes." The badge felt heavier when Dr. Pierce unclipped it from his belt, the laminated photo of a younger version of himself, someone who'd believed competence was enough, that excellence could protect him from consequences. It couldn't. By Thursday, Nurse Jameson had made a statement to the board. "Dr. Pierce told me Ashley Cooper was dangerous. He said she wasn't qualified. He pressured me to keep my distance from her." Patel admitted the same thing. Then the Seattle Community College records appeared, a fabricated inquiry that Patel had revealed he'd fabricated, on Pierce's implicit instruction. Then Hayes's parents filed their complaint, that their son's physician had refused to allow the nurse to intervene during the code, that he'd blocked her from helping while their son's heart stopped. The State Medical Board's letter arrived Friday morning, typed on official letterhead, each word a nail in a coffin that was already sealed. "Physician misconduct investigation initiated. Charges may include gross negligence, abuse of professional authority, and endangerment of a patient." Dr. Pierce stopped going to the hospital. He stayed in his home office on Aspen Ridge Drive, the 6,200-square-foot colonial with a 3-car garage and the medical school diplomas framed on the walls, watching the video loop on his laptop. Frame by frame. The moment Hayes's parents' faces changed. The moment the Marine Colonel's salute registered in his periphery. The moment his own voice said those words and the room went so quiet you could hear the fluorescent lights hum. He'd been hunting weakness his entire career. He'd found it. It was himself. The investigation would take 6 weeks. 6 weeks of his network dissolving, colleagues texting to say they needed distance, the country club social committee postponing his membership vote indefinitely, his ex-wife's lawyer calling about revisiting the custody arrangement for his daughter. 6 weeks of watching his life collapse in real time while the internet decided whether he deserved to keep his medical license. He applied for clinic jobs at rural facilities, places where the story hadn't reached yet. They called him back. Then they called back again to rescind the offers. His name was radioactive. His reputation wasn't just damaged, it was weaponized against him. The man who'd spent 3 years building a coalition to destroy an invisible nurse had become invisible himself. But not in the way he'd intended. On week 6, the chief of surgery called again. Your suspension is being made permanent pending the final medical board review. In the interim, we've arranged a position with the Colorado Emergency Medical Services Foundation. You'll be coordinating supply deliveries to rural clinics. It's not patient care, but it's employment. Take it or resign. The position came with a salary cut of 73%. Dr. Pierce took it. That Monday morning, he stood in the equipment depot at 5 o'clock, loading medical supplies into a white van with the foundation logo on the side. Bandages. Saline. Ventilator tubes. The same supplies he used to order through hospital channels. Now he was hauling them himself, driving them to clinics in towns with names he couldn't pronounce, places where nobody knew his name. His physician credentials sat in legal limbo. His medical school mentor had disowned him publicly. His network had evaporated. The isolation was absolute. It wasn't punishment, it was erasure. The same erasure he'd tried to inflict on Ashley Cooper. He understood the irony. Understanding it didn't help. At 7:48 a.m. that same Monday, Ashley Cooper walked through the main entrance of Seattle General Hospital wearing her captain's bars for the first time in 3 years. They were pinned to the left chest of her white coat, insignia visible, non-negotiable. The staff near the reception desk saw her first. Then the nurses. Then the orderlies. By the time she reached the ICU corridor, everyone on that floor knew she'd arrived. The applause started in the break room, genuine, sustained, some of them crying. Nurse Jameson led it, palms striking palms, his face wet with tears. Dr. Harrison, the chief of surgery, stood in the hallway with his hand extended. Welcome home, Captain Cooper. Your office is ready. The office overlooked the entire ICU from the second floor, a glass wall with a view of every bed, every monitor, every patient currently fighting for their lives under her new authority. On the shelf behind her desk sat 2 objects. The first was a shadow box, the folded flag from Sergeant Maria Ruiz's dress uniform, pressed and preserved and finally removed from the plastic wrapping. The flag that represented 18 years of silence, of erased records, of a classified operation that had cost lives no one was officially allowed to grieve. The second was a framed photograph from the White House ceremony 6 weeks ago. Corporal Hayes in his Marine dress blues, grinning like someone who'd been given his life back. Marcus in a suit that fit him perfectly, shaking the Marine Commandant's hand. Ashley in her captain's dress uniform, receiving a commendation for service rendered, for lives saved, for a sacrifice that nobody outside this room was ever supposed to know about. She touched the frame once, then turned to the window. Through the glass, she could see the parking lot. The white supply van pulled up to the loading dock. A figure in civilian clothes began unloading equipment. Even from this distance, even with his back turned, she recognized the shape of his shoulders, the angle of his posture, the way he moved like someone carrying a weight he couldn't set down. Dr. Pierce looked up once. His eyes found hers at the window, Captain Ashley Cooper, Director of Emergency Medicine, standing with her office at her back and a folded flag on her shelf, watching him load supplies into a van. She didn't wave. Didn't smile. Didn't acknowledge him with anything except sustained eye contact that said everything without saying a word. He looked away first. He loaded the last case of saline, closed the van doors, and drove toward the exit. Ashley watched until the white vehicle disappeared around the corner. Then she turned back to her office, her command, her life returned from the dead. That evening, she gave her first address to the entire ER staff. They filled the conference room, standing along the walls, waiting for whatever she would tell them. She stood without notes, without preparation, with only the weight of 3 years of silence behind her eyes. I spent 3 years hiding who I was, she began, her voice quiet but carrying to every corner of the room, because I was ordered to disappear. Because a classified operation in Bagram went south and the Pentagon decided that erasing our records was cleaner than acknowledging what happened there. Some of you believed lies about me. Some of you walked away when I needed colleagues. I won't pretend that didn't hurt. But every one of you became a nurse or a doctor because you wanted to save lives. That's what matters now. We move forward together or we fail alone. She paused. Her hand moved to the flag on the shelf behind her, a gesture so brief most people almost missed it. Sergeant Maria Ruiz carried me 40 yards when I was hit in Bagram, Ashley continued, and her voice changed, just slightly, just enough that everyone in the room felt the shift. She died getting me to the helicopter. She never got her commendation. Never got her ceremony. Because our operation was erased. This flag reminds me every single day, true heroism is what you do when the world stops watching. The silence lasted exactly 3 seconds. Then Nurse Jameson stood, hands coming together, and the room followed. The applause built like a standing ovation at the end of a performance that mattered. Ashley's jaw clenched once, not from pain, but from the precise, controlled effort of letting herself feel something other than duty. Her eyes stayed steady. Her composure held. But this time she let herself smile. Outside, the Colorado Springs sunset was bleeding orange and red across the mountains. The supply van was already gone, its driver already halfway to the first rural clinic, already beginning a life without a title, without recognition, without anything except the knowledge that he'd picked a fight with someone he'd fundamentally misunderstood. The irony had sharp teeth. It also had perfect aim. If you're watching this, you already know what happens when you underestimate the quiet ones. Subscribe and hit that notification bell so you don't miss the next story, and tell me in the comments, what would you have done if you were standing in that board meeting when those medals came out?